Welcome, and thanks for choosing AdBite. In this video, I'm going to show you how to use your RAPCove COVID-19 rapid test. RAPCove COVID-19 rapid test is a serological test for the qualitative detection of IgG antibodies to the COVID-19 virus in human whole blood fingerstick samples. Your RAPCove test kit should include 2 packages. The first is a foil-wrapped test cassette with a desiccant inside. The second is the sample collector pouch, which includes an alcohol prep, TruePlus safety lancet, micro-safe pipette, and buffer solution. TruePlus safety lancet procedure for fingerstick. Wash your hands thoroughly. Select the fingerstick site. The patient should be sitting or lying down. Hold out the hand in a downward position, allowing gravity to help increase blood supply to the hand. Select finger. Middle or ring finger is preferable. The 5th finger must not be punctured because the tissue depth is insufficient to prevent bone injury. Disinfect the fingerstick site. Cleanse the puncture site using the alcohol pad provided. Twist off the tab to break the seal and discard the cap. Please do not directly pull off the protective cap. Perform the puncture. Position the safety lancet firmly against the puncture site as illustrated. Hold lancet between fingers. To activate, press safety lancet firmly against the puncture site. Let blood sample form. Discard used safety lancet into a sharps container according to established procedures. Procedure for collecting blood specimen using micro-safe pipette. Squeeze gently going along finger capillaries up to the puncture site to produce a blood drop on the fingertip. Hold the tube horizontally and touch the tip of the micro-safe tube to the blood sample. Capillary action will automatically draw the sample to the air vent and it will stop. To expel the sample, align the tip of the tube with the sample target and squeeze the bulb. If a sample won't expel, you probably didn't allow for the tube to fill all the way. Touch the tip of the blood sample again and allow it to fill completely. Then align the tip with the sample and squeeze the bulb. Performing the assay. Add whole blood to the oval sample well using the micro-safe pipette. Allow the sample to absorb entirely into the specimen pad within the sampler well. Open the buffer dropper by twisting off the top. Hold the buffer dropper vertically and 1 centimeter above the oval sample well. Add 2 drops of buffer to the sample well. Read the result exactly 15 minutes after adding the buffer to the cassette. Do not read results after 20 minutes. Discard the test device after recording the test results. Results. Positive test. Pink bands appear in the control or top line and IgG or bottom line. The test is positive for IgG antibodies to COVID-19 virus. Negative test. Pink bands appear in the control only. The negative test does not exclude COVID-19 infection. Invalid test. No pink band appear in the control. The test is invalid and should be repeated. And that's it. Now that your test is complete, if you require more information, head over to rapcove.com. Thanks for watching.